host these master classes live every month, and the topics change each month. So we've done protein, we've done menopause, and today we are here to talk about sleep and the sleep weight connection. And so, again, thank you guys so much for taking some time out of your day today to join us. Usually these classes run between 30 and 45 minutes. And so that's kind of our time frame here today. And I'm joined by Dr. Leon Katz. We're thrilled to have him, and Whitney Gibson as well. My name is Austin. I'm the co-founder of Alterra Health. And I'll let Dr. Katz and Whitney introduce themselves as we progress here. Just a couple other points to mention. So we try our best to make these sessions as interactive as we possibly can. And so if you have a question, please write in through the Zoom chat window. You can just type it directly there. If you have a question you would rather email, you can email one of us. My personal address, it's austin@alterrahealth.com, and Alterra has 2 R's. So questions, again, please chat in the Zoom window here or email us. We're expecting a combination tonight of both providers and patients. And so for providers, I mean, if you've seen something in clinic or have an experience as well that you would like to share, by all means. Our last session was very interactive, and so we're trying to do that again tonight. And then be sure to pay attention for the email that'll come with a recording after this session, because we're giving away a free sleep guide that patients, you can use this guide directly, and providers, we're offering this guide so that you can share it with your patients as well. Last thing before I turn it over to Whitney, just in case you'd like to know more about Alterra Health, we are the leading provider of lifestyle education through a platform, and we cover nutrition, exercise, mindset, community, habit change. And so providers, if you're struggling to deliver lifestyle care during a busy consult, we can help you, and we support all aspects of lifestyle care outside of consults. You can visit alterrahealth.com for more information about that. And with that, Whitney, please take it away, and let's get going.
Hey everyone, I'm Whitney Gibson, registered dietitian, lifestyle coach, and co-founder of Alterra Health. We are so excited to have you here today. We want to bring you information about the connection between sleep and weight, because it is such an important lifestyle change and thing that you need to tackle in order to get that lifestyle to where you want it and obtain a healthier weight. But whether you're a provider or a patient attending tonight, this masterclass will be able to provide a better understanding of the science behind sleep, your health, and your weight. So tonight we have 5 commonly asked questions about sleep that we'll discuss. And we have the amazing Dr. Katz co-hosting tonight's masterclass as our expert. Dr. Katz, I'm going to let you do a brief introduction of yourself, and we'll hop right into those questions.
Okay, good evening, everyone. Pleasure to be here. Thank you, Austin and Whitney, for allowing me to participate. So I am a bariatric surgeon by trade, have done bariatric surgery for over 20 years, and approximately 5 years ago, made a decision to move over from bariatric surgery into medical weight loss. So pretty much working in the field of helping people struggling with weight and obesity for over 25 years. I bring a great deal of passion. I myself used to be overweight when I was younger, so I have a different perspective on the subject, and pretty much looking forward to providing some useful information regarding the connection of sleep, lack of sleep, and weight gain. So here we go.
Sounds like we're ready. So now what you're all here for, let's dive into these top questions so he can share his expertise. So number 1, what is exactly the connection between, or the science behind, sleep and weight gain?
Okay, so here we go. And before we get into the science, which I promise we will, there are some practical components of not getting enough sleep and also gaining weight. For starters, if you're awake for a longer period of time, that's just more opportunity to go ahead and eat. People are prone to snacking thereabouts. So if you're up for 18 hours a day instead of getting less hours because you're not sleeping, that's more opportunity to eat. In addition, if you're really tired, the concept of go to the gym or go exercise and keep moving, that's just not going to happen. We can promise ourselves, you can hear the clinician telling you you need to do it, you say you'll do it, but you won't. So now let's get into the science behind this, because it's not as simple as you didn't sleep enough, you ate too much, and you gained weight. What the science shows us, There are two main hormones. There are actually probably 2,000, but the two that we know pretty well, there's something called ghrelin and there's something called leptin. So ghrelin is a hormone made in the stomach, and ghrelin is considered orexigenic. Very simply, if you're all familiar with anorexia, where a person doesn't eat much and unfortunately is starving, orexigenic is basically the tendency to be hungry and wanting to eat. So ghrelin is orexigenic. Ghrelin leads to more food intake. Leptin is a hormone that's made by the fat cells, and it has the opposite effect. It's anorexigenic, so it sends the sensation of being full. What happens is, and the studies were performed, and I'll add some of these studies so that you'll be able to read them. But the study showed pretty conclusively when volunteers were taken and they were not sleeping adequately, less than 7 hours of sleep, the ghrelin level, the I'm hungry hormone, went up by about 15%. On the other hand, the leptin hormone went down by about 15%. In other words, the signal that you're hungry, you want to eat, that went up. And you know what? I'm full. I don't want to eat. I'm not interested in snacking. That signal went down. Net effect is more consumption of food and subsequently weight gain. But in addition, for people, if you break it down to sleeping less than 7 hours, 7 to 9 hours, and more than 9 hours, what was really interesting, one of the studies showed when people slept more than 9 or 10 hours, we'll call them people that sleep long, these people had a greater tendency towards processed food, towards meats, protein, but really the ultra processed meats. Those were the people that slept too long. For people that slept a short amount of time and didn't get enough sleep, those people had more of a tendency to go for the fats, the fried foods. The ones in the middle, like the Goldilocks rule, the ones straight in the middle, now they tended to have a desire for healthy carbohydrates as well as fruits and ability to increase the vitamins. So it's really interesting, depending on the amount of time you sleep, that tends to play a role in what you have cravings for.
So interesting. So interesting. Thank you. All right,
Mhm.
number two. This is a common one, and we might not know the answer to this. We obviously don't because we're asking you, the expert. Is it normal to wake up multiple times a night?
So the short answer is no, it's not. That's the short answer. On the other hand, if you break it down based by age and also just physiologically, so for starters, people that are older generally have a tendency to sleep less, wake up more, and that's probably more of a physiological component. I certainly don't have an explanation or any studies, but the general observation is people that are older need or get less sleep. Now let's talk about the practical aspect, anatomy. So it's not surprising older men tend to get up to go to the bathroom more frequently because of the prostate enlargement. But getting a little bit into the doctor slash surgeon mode, as the prostate increases in size, there's a part of the uh, basically the urethra, which is a connection between the bladder and the outside, the delivery of the urine. The portion going through the prostate tends to be diminished. The end result is when a man goes to urinate before going to sleep, they're not able to empty out of the bladder properly. So what happens, they go to sleep, the bladder starts filling with urine, and so the fibers giving the message that the bladder needs to be emptied, those fibers get activated more sooner compared to someone that was able to completely empty their bladder. That's the men. The women, they don't get away scot-free either. One of the main reasons is after had childbirth or multiple kids being delivered, the pelvic floor becomes weaker and also the bladder becomes weaker. So emptying out the bladder can also be an issue for women. And once again, same concept, more of a signal to the brain that the bladder is getting full, gotta go. So that's those components. In addition, separate from that, there are conditions, for example, sleep apnea or restless leg syndrome. Now, the one I spoke before with the emptying the bladder, the person wakes up, they're aware that they're awake, and it's hard to fall asleep. But now we're talking about more at the subconscious level. People are probably familiar with the REM sleep, and you have stages 1 through 4. The problem with people that have sleep apnea or restless leg, it's not that they wake up, but they never really fall into that deep state. So, for example, people with severe sleep apnea, they can end up waking up 60, 80 times per hour because they have episodes of slowing down their breathing. And so, someone like that, even if they sleep, quote unquote, for 10 hours, when they wake up, they are exhausted. They feel like they got no sleep. And so part of that leads to weight gain. On the other hand, it's the weight gain that increases the chance of sleep apnea. So a very vicious cycle.
I know we're not going to talk about this tonight, but I know a lot of our patients that are on this masterclass tonight or attending tonight, maybe in the perimenopausal phase, and we're constantly talking about sleep. I don't know if you can add anything tonight. I wanted to tell everyone we do have a perimenopause masterclass coming up next month, and we will cover this. So, Dr. Katz, can you
Uh,
add anything according to
yeah.
perimenopause?
So I will add there are some of the basically nerve-related conditions. So for instance, the hot flashes. The hot flashes, and it's kind of obvious, but at the same time, the hot flashes, which is more of the neurological vasomotor, but the bottom line, hot flashes tend to cause women to wake up more often, and it's either too hot, too cold, and it's not something that a woman per se has any control. She can turn on the air conditioner stronger, she can go under the blanket, but the bottom line, the person just woke up. So that's one part of it. Also, I believe in and of itself, menopausal or perimenopausal time frame can and does affect the quality of the sleep. So in women who are perimenopausal, there's something at a biological hormonal level, which is separate from necessarily hot flashes.
Okay. Yeah, if you guys are struggling with sleep during perimenopause, postmenopause, we'll definitely be covering that next month in our masterclass. Next question. Why do I crave junk food or eat more when I'm tired?
Well, as mentioned before, part of the problem is when you're tired, in the old days, or kind of thousands of years ago, in order to survive, if a person at night fell asleep when they should have been vigilant, there was obviously a signal at the level of the brain that you need to keep yourself awake. We're talking way before caffeine. So I believe one of the answers is that that tendency towards foods that have more of the pep that may wake you up, some of the, for example, adrenaline rush, that tends to come from the food that today we would call unhealthy. The the difference being is back then people were far more active and the portions were not tremendous like they are now. That's number one. Number two, as I mentioned, there was a study, and I'll present that, that interestingly enough showed that when people sleep short periods of time, there's a craving for the fatty food. I think it boils down to one component of a person's weight and weight gain or weight loss. We call it the hedonic from hedonism or dopamine. And so what happens is when a person is exhausted, from what the literature shows, there's a greater tendency for that reward system to be activated. And so there's a greater tendency for foods that are fried or fatty. So I believe that's kind of more of a scientific explanation why being really tired tends to contribute to people wanting to eat foods that are less healthier or the cravings.
Yeah. That's why sleep is so important because we do end up with cravings and we don't know what those cravings could really be speaking to anything that we're missing, not even just sleep, but at the end of the day, it's sleep. And when we're tired, we just get all these mixed signals and it's hard to identify what we truly need. Okay, next question. And I lied to you guys. This is only 4 questions, but we're going to kind of tack on some more explanation in this next question. So next question is, what can I start doing to sleep better and improve my health?
Okay, probably one of the most important questions that applies not just to the people in this conversation, it applies to everyone from your children to your spouse, to your parents or grandparents. So a couple of things to consider. Number one, when it comes to consumption of caffeine, just to know, not everyone reacts the same way to caffeine. You know people that they drink coffee 20 minutes before going to sleep and they fall asleep instantly. Conversely, there are people that they drink coffee at like 11 a.m. and they're up the whole night. So when it comes to caffeine, probably the best, most practical advice, use yourself as a guinea pig just to confirm whether caffeine has an effect on you, instead of kind of blindly saying no one should drink caffeine after a certain hour. That's number one. Number two, it's called sleep hygiene. So sleep hygiene refers to the concept that in order to fall asleep, there are certain steps you can take to increase the odds that you'll fall asleep more easily. So your bedroom should really be used as a bedroom. For a lot of people, typically the bedroom serves as a bedroom, as a kitchen, as a dining room, entertainment. And the problem with that is that your bedroom and that environment is no longer associated with being tired or going to sleep. You now have situation where you walk into a room and you're more prone to wanting to get on that phone or watch one more show, or you wake up, you have your breakfast in bed. So one of the best things is leave the bedroom as the place to sleep. All other activities, do it in appropriate rooms. That one will go a long way. Number two, the use of electronic devices. I think it's completely not realistic to tell people put away your iPhones or iPads or computer 3 hours before you go to sleep. That may sound like a good book answer. It just doesn't work in life. I know I can't really do it. I don't want to be a hypocrite. I'm confident saying nobody on this event is able to put away and turn off all digital media for 3 or 4 hours before sleep. But there is room for compromise. Number one, almost all of these devices have the option of turning on the night mode. So instead of having the bright kind of blue tinged light in your phone or computer, it becomes more of a beige color. So that plays a role. One of the challenges of being in a brightly lit environment is that your brain secretes something called melatonin. And melatonin has to do with a kind of reminder to your body it's time to go to sleep. In fact, some of the people here may very well be taking melatonin pills to help you sleep. The challenge is if you're watching bright light, you're exposed to bright light, the melatonin is not being secreted properly. As a result, you don't have that desire or urge to be tired and go to sleep. So try to use the devices in dark color or in night mode. The other thing is purely practical. When you go into your bedroom, if you can, put that cell phone about 6 or 8 feet away. Don't put it right next to you in the bed. So when you hear that little ding, that impulse to immediately turn over and take a look at the phone, the famous, yeah, but it could be an emergency, which 99.9% of the time it's not an emergency because you'll get called if it's something bad. By doing that, there's just less desire to get out of bed to take a look at it. So these are some of the practical things you can do to really improve the quality of your sleep.
So
Can
I'm
I
going
ask
to
a
tack. Oh, go
Can I
ahead.
ask a quick follow-up? Sorry, guys.
Yeah.
Dr. Katz, we had talked a few months ago, and I know you elaborated a bit on night shift workers, people working overnight. And with, Alterra Health, a lot of the patients that we work with might be nurses, firefighters, police officers, people working that late night shift. Can you just touch a little bit on, why that might make you eat more and what to do in that situation?
I think it's a great question. As we've become a 24-hour a day, businesses open 24-hour a day society. So I remember when I was doing surgeries in the hospital late at night, and of course there was that shift of the hardworking nurses and nurses aides that were up the whole night. So once again, the change in the secretion of hormones. So this is kind of the fancy schmancy scientific answer, change in hormone secretion, decrease in melatonin, decrease in the proper secretion of cortisol, which usually happens more towards the morning. But for people that start their job at, let's say, 11 p.m. and work till 7 a.m., completely changes the biological part. Now, there is a psychological part. And also, again, I would call the hedonistic or the dopamine, and it's so hard to deal with it. And I remember in the hospital, the first thing I would see the nurses when they got together for the night shift, even before talking about who's the sickest patient, what do we need to do for them. The reality is, and I don't judge anyone, the reality is the very first most important question is, girls, where are we ordering our food from? And then the menu starts getting passed out and the food is being ordered. I don't think I have to tell you, nobody was ordering some fresh salad. That's just not reality. We were talking about the good stuff, i.e., lots of carbs, ultra processed. So you have that. And you also have that camaraderie. Everyone's eating the same good tasting food. And for people to bring their yogurt and vegetables from home, it's not going to happen. So that, but scientifically speaking, the change in the hormones that's secreted, and as I mentioned, those that sleep less than 5 hours, more of a tendency or desire towards the fatty food, and the ghrelin and the leptin levels being kind of reversed inappropriately. So the night shift crowd definitely has headwinds ahead of them to try to even maintain their weight.
I wanted to add a few things just to add to the discussion on nutrition related to winding down for sleep, and also where routines come in. So I work a lot with my patients in Alterra Health with setting routines for themselves. So I'm just kind of going to go through this list of tips essentially related to nutrition first, and then I'll get into schedules. But number one, eating too late. So sometimes we're not eating enough throughout the day, and then dinner hits and we open up the floodgates for eating. We're so hungry, or maybe we're not hungry throughout the day. We're working so hard throughout the day that our minds aren't really communicating with our gut, true communication signals there. So we wait too late to eat. If we're waiting too late to eat and then we immediately go to bed, we're not resting. That's not rest. That's not quality sleep. Our body's actually working to digest. So you're not truly getting deep sleep, especially for a while that's happening. So really you want to avoid eating too late for that one reason. There's many reasons, but that's one reason. Another thing would be alcohol. I know we don't talk much about alcohol, but alcohol can really disrupt sleep patterns, especially if it's more than one, what is it, 4 ounces or at max 8 ounces of wine. That's a lot, but that's going to end up interfering with the sleep, metabolizing the alcohol itself. It may be too sugary, whatever substance you're having. So I would avoid alcohol immediately before sleep. Have that happen earlier on in the day, immediately after, if you're going to have a glass of wine or one beverage or so. Also, protein and carbs. So if we're talking about, if someone's telling me I'm hungry before bed though, well, number one, that's probably telling me you're not having enough protein or balanced meals throughout the day. But if you do need to have something after dinner, make it a good combination of a protein rich snack mixed with a high fiber carb. So this could be something like an apple and peanut butter, or cheese and crackers, or something, minimally processed, but something small that can just curb your hunger just a little bit. That should be enough to satisfy you enough to where you can have a restful sleep and you're not starving when you're laying down. Also, not waiting too long to go to sleep after your last meal. So if you're doing some type of intermittent fasting, for instance, if you're trying to cut off your dinner time or your last meal time by 6 p.m., but you're not going to bed by 11 or 12, you're going to get hungry. So you kind of have to be intentional about where you're putting your last meal and what your bedtime is. Now, going further than that, that would mean that you really do need to have some kind of scheduled routine or some kind of a plan, intentional plan on when your last meal is going to be, what your bedtime is set to be, and what's going to happen in between that time. And what should happen in between that time is having some kind of a wind down routine, whether that's a shower, a warm bath, reading a book, doing some kind of a sleep meditation, or listening to something calm in your earphones, avoiding that blue light. So anything that you can do to really instill some kind of a relaxation prior to bed, so that you're training your brain, hey, it's time to go to bed. This is what we do when we go to the bedroom. So it's very much a training your brain type of activity and training it to know what to expect. So we work a lot on nighttime routines in our program, and in order to get a restful night's sleep, you really do have to know what's ahead of you, what to expect, and how are you going to do that. Furthermore, that actually translates into your or connects to your morning routine. How are you starting your day? So if you really have no control over your daytime, it's going to affect your nighttime. So I can't say it enough. Take control of your day and really make some type of a plan and structure and discipline so that you are setting yourself up for the end of the day and a good night's sleep. Was there something else I wanted to add to that? Did I miss anything? Anything else you can think of going on what I just mentioned, Dr. Katz?
Yeah. No, I think you definitely, it's almost like the concept of behavior modification or
It is.
cognitive behavior modification. So it's really kind of approaching it as multi-pronged, and perhaps for some of the people that need to utilize sleeping aids or medication for sleep, perhaps, not for all, but perhaps by utilizing some of these sleep techniques, it is possible for your medication for sleep to be the diminish how often you need to take. You may be able to come off the medication altogether. So something to consider. That would be a big, big improvement.
Oh, I know what I was going to say. If you're not exercising, you got to do something. You got to get that energy out of your body, especially if you're a person that's in a very stringent job where you're working long hours. There's got to be some kind of release of that energy that's all pent up, or else that turns into stress, which also affects your sleep. So if you're not moving during the day, we really have to release that out of your body and get you to calm down, kind of essentially wear yourself out. So we don't wear ourselves out by having alcohol or by watching a long movie right before bed or watching something extremely exciting or something that's going to excite the brain. You really have to think about what excites my brain, what calms my brain, and start choosing those activities to set yourself up for success.
And Tiffany, along those lines about exercise, routinely I hear from my patients that, look, I'd like to, I just don't have the opportunity. And some of them legitimately, they're up at 4:30 in the morning. They come home at 7 p.m. I don't think it's even fair to say, well, you got to go and do stuff. But there are opportunities. I tell all of them at work. Number one, if you can walk further from where you park your car, that's a no-brainer. If you have any stairs, both at home or at work, every hour, just walk, let's say, 1 or 2 flights, come back. Or if you have an elevator that you use and you're on the 8th floor, instead of at the lobby, walk up 1 or 2 flights and then go from second to 8th floor. Do that once or twice a day, 3 times a day. Now you're getting quality exercise without really being aware. I also sent all my patients a resistance band. And while it's nothing fancy schmancy, it's small. You can put in your bag, even at work. Kind of, if you got your 8, 10 minutes, do some resistance exercise. Do that 2, 3 times while at work. So there are many ways to approach this without being in a situation where it's not practical for you to work out at 4 in the morning or at 8 at night. So
Right.
things to
I, I,
consider.
I tell all my patients, I'm an excuse buster. You tell me your schedule and I'm going to tell you where you can fit it in. I'll get you 30
Mm.
seconds of exercise in every couple hours. Standing desks, resistance bands, just like you said. Yeah, we've got tons of stuff on our platform, even that are fully accessible, from the chair, from a desk, at work. So we really have to kind of optimize on, if you do have a busy life, there are ways to get around this. You may not have an extensive routine or, a magical routine like some people, but you can make it work for sure.
Mm.
All right, guys, I think that's all we've got for you. Austin, I'll give it to you for close.
Awesome. Well, thanks to everyone for joining us this evening. We're at exactly 30 minutes, so perfect timing. If anyone has questions, we'll still be on for just a second, so feel free to write in. Again, for questions that you would prefer to email, my email, it's austin@alterrahealth.com. Again, we host these live every month, so we would love to see you again next month. For the patients on the call, this recording and then the sleep guide will be in your clinic's platform tomorrow. For the providers, we will send you an email with this recording and the guide, so be on the lookout for that just a little bit later this evening. Dr. Katz, as always, it is an absolute pleasure to have you. Whitney, thanks as well for joining us. And I think with that, we're good. And again, if you would like to learn more about Alterra Health, it's just alterrahealth.com, and we're happy to help. So have a great evening. And again, thank you so much for taking time out of your schedules to join us.
Good night, everyone.
Bye, everyone.
Good night.